This is Dr. Janoon presenting the case for Andrea Matthews, a 32-year-old Caucasian female insured by United Healthcare. This is a referral to both a retinal specialist ophthalmologist and an occupational therapist. The chief complaint of the patient is she's having difficulty viewing her computer monitor at work. It's progressively been getting worse over the past year. She also has concerns about being able to drive as she is a single mother with 2 children. Now, she does have a positive history of retinitis pigmentosa. The patient denies any other medical conditions, and she's taking no medications, and there's also a positive history of retinitis pigmentosa in the family. Both her brother and her aunt were diagnosed with RP. Now, when testing her visual acuities, she scored a 2040 OD, 2030 OS, 2030 -2 OU. That was uncorrected, and also uncorrected was her near VA. She scored a zero point 0.2 out of zero point 0.8 with the Lighthouse Acuity Cards OU. Now, looking at confrontation visual fields, I did find general constriction in all quadrants, both OD and OS. She scored 25 degrees temporally on the vision disc OD and 20 degrees temporally OS. Now, when looking at the anterior segment, I did find trace posterior subcapsular cataracts in both her OD and OS. That does need to be taken a look at. And then when looking at her posterior segment, I found no holes, breaks, or tears in either eye, but there was positive bone spicular pigment in both eyes with changes at 360. Now, I think the best course of action would be to have the patient go to the retinal specialist, confirm the diagnosis, see if there's anything that we can do, and then from there we work with the occupational therapist to teach the patient as low vision techniques as to how to live with retinitis pigmentosa. Thank you all very much.